Okay, can everybody see my screen?
Yes,
We're moving.
uh,
Awesome.
computer screen on mine, Victoria.
Yes, everyone can see my slide deck. I'm gonna try to wide open the Zoom, everyone's faces so that I can see. As usual, it's worth mentioning that the meeting is being recorded in compliance with the state's public meetings laws.
Yes, I got notification.
Yeah. So with that in mind, welcome everyone to the first quarterly meeting of the 2025 fiscal year of ASGARN, Advisory Stakeholder Group on Autism-Related Needs, or we can call it ASGARN because that is a mouthful. To start off, we usually have the meeting guidelines, especially for any newcomers. The goal, create a safe, positive, inclusive environment for the advisory group, participants, staff, the public. We want to create a safe space for diversity of contributors, thoughts, ideas. And obviously, one of the things I want to ask everyone, assume positive intent on the part of other participants, other advisory members, and so on. Listen actively, not listening to respond, one speaker at a time. And you should prioritize those who haven't spoken yet. And that is something I try to do when calling on multiple raised hands. Default to both and thinking instead of either or. And for the members of the general public, please wait for the appropriate open forum section to speak. Members of ASGARN can interrupt me, but I do sometimes ask if what you have in mind is very big. Like, we will also have an open comment section for ASGARN members. So if I tell you, okay, let's take that topic a bit later, I promise it's not trying to silence you. With that, we will start off with a legally obligatory roll call, as we need to have a 50% plus one of the folks. Otherwise, it becomes a different type of meeting. And Ellis will do the roll call as they have the spreadsheet that auto calculates. Ellis, you're on mute if you're not. Ellis?
I'm sorry, I
No
had
worries.
difficulty pulling it up. So, hello, we're going to do roll call. I'm going to say your name, and then if you're here, say present or some way to let us know you all are here. And then we're going to go on to the next one. Okay, thank you very much. First off, we're going to start with the governor appointed members. Adam Schaefer Jones.
Present.
Thank you. Christy Russell.
Present.
Thank you. Devin Sutherland.
Present.
Thank you. Emily Arker.
Present.
Thank you. Lisa Viderley.
Present.
Thank you. Nicole LeBlanc.
Here.
Thank you. Peggy Pugh.
Here.
Thank you. Roger Thibodeau.
Present.
Thank you. Now we're going to go over to those members who have been appointed by the coordinator. First off, Elizabeth Benavides.
Present.
Thank you. Gregory S. Robinson. Thank you. Jillian Prince. Thank you. Jess Wilcox Cowing has emailed their inability to attend. Lydia X.C. Brown.
I have a pulse and I'm present.
Thank you. Melissa Rosenberg. Thank you. Nancy Forsyth.
Present.
Thank you. Nikki Stokes.
Present.
Thank you. Rachel Leah Krause.
I too have that pulse and I am present.
Thank you. Ryan T. Roddy?
Present.
Thank you. Trevor Bird? Thank you. Jordi Tavares? Thank you. Delegate Julie Palikovich Carr?
Good afternoon.
Thank you. Delegate Michelle Guyton?
Present. Nice to see you all.
Thank you. And the ex officio members, Amy Taubenfeld?
Present.
Thank you. Fatima Salem? Thank you. Rachel London? Thank you. Raymond Marshall? Thank you. Rebecca Rienzi?
Present.
Thank you. Now we're going to go through the government officials. Carmen Brown? Thank you. Courtney Thomas Winterberg?
Afternoon, present.
Thank you. Janet Furman? Thank you. Anne Blackfield?
Present.
Thank you. Victoria Rodriguez Roldan? I return it to you.
Present.
And with that, I announce we have a quorum.
Yay. Okay. Let's move on. As opening remarks, I just want to say, welcome everyone. We have a lot of updates to move forward, and I want to thank everyone who has participated in the first 6 months of the year when we were doing all the strategic planning process with the subcommittees. That process has resulted in a lot of progress lately with the new draft, and we also have on the leadership side a new deputy secretary who I will introduce very soon, which is the topic of leadership transitions. And Blackfield is our newest deputy secretary of disabilities. She is taking over as the secretary's designee for this for ASGARN. So she will be attending all the quarterly meetings, and it's already hit the ground running in an amazing way, helping us craft the strategic plan. So with that, Anne, do you want to introduce yourself beyond what I said?
Sure. Okay. Can you hear me?
A bit grainy.
Hello.
We can hear you, but grainy.
Let's see. Yeah, let me just try moving my phone. I dialed in, which might have been a mistake. Is that any better?
We can hear you. Can you
Okay,
hear
great.
us?
I can. Yeah. Sorry, I'm having a little trouble with my headphones. Meet everybody virtually. I joined the department a month ago as the deputy secretary. I did previously work for the Department of Disabilities in a different capacity 8 years ago. I was the director of interagency affairs and hopefully developed skills that will be helpful as a designee on this committee, including I've worked on like the state disabilities plan before that MDOD releases. I used to be in charge of doing a lot of our like legislatively mandated reports. I worked on legislation like the ABLE Act task force that created the ABLE Act program in Maryland and the phase out of sheltered workshops. So I had some experience 8 years ago. I spent the last 8 years at the Centers for Medicare and Medicaid Services doing rule writing and then implementation strategies for rules that CMS published. So I said, hoping to lend my support to this group and looking forward to the work moving forward. And I'll turn it back to you, Victoria.
That's great. So to give a few updates, what's the status update on the strategic plan, which is the big doozy that is occupying, sometimes I like to joke that every waking minute of my life, and I look forward to a day that I'm not thinking about it, I'm thinking more of how to implement it. As an update, we do have a draft now. We will not be sharing it yet, but I created it first after we were wrapped up with the strategic planning process with the subcommittees, 50-page draft. Anne has whittled it down to like 30 pages, more looking like a government document and taking out some fluff. We right now are planning to do a dual-phased approach. One is the strategy, which is the document that will be published published initially, and a work plan or implementation phase, which is essentially more of a shorter spreadsheet type or outline type document that will be published every year with the start of the year as to what are we planning to implement this year. Because, for example, if when you're thinking of the next 5 years of the strategic plan, which is the strategy element, you have to be very vague as to how to implement it. Because imagine if you had gone to 2019 and said, let's plan out the next 5 years, and then COVID happened and the world ends and comes back again. So we have to think about that. And thus every year we'll have a new work plan based off the strategic plan, as well as state worldwide events and so on that affect things. It is, after that, there will be a review process. Currently, that draft is already, we are working with leadership at the agency. It will have to be reviewed by the leadership at the governor's office. I would like to clarify, and of course, I will be sharing some of the outline of what it might look like in the next few slides, but I want to be clear that no matter what feedback you might give, and I know that all of us have like ideas that we would love to see in, I cannot guarantee, or even Anne cannot guarantee, that any one thing will make it, because it has to be reviewed by state government leadership and approved at the highest levels. With that in mind, we will go forward and go under like what it might look like. And this is still somewhat in a rubric, but an idea. I think that will happen is towards the end of the draft document, we will share the nearly final or final draft with ASGARN in advance. It will be an embargoed copy, so not to be shared with your 20 best friends, obviously. You can provide a little bit of feedback here and there, but again, I cannot guarantee what will make it at that point. It's not at that point will not, like, we're reaching a certain stage on it. And one of the structures that will happen is there will be a background, a note on language, for example, by which we mean we are, because people feel very strongly about the topic of identity first language or person first language, we're trying to use it in an alternating way to acknowledge everyone's needs and feelings on this topic. There will be a structure, there will be the vision and mission statement, which we've already discussed, discussion on how it was developed. And it will be divided by the guiding principles, which we've talked about a bit about in the past. For example, the guiding principle 1 would be people with autism should be able to live and thrive in their chosen communities. And thus we go to those topics that fall in there, like education, employment, transportation, housing, for example, which are, you might recognize as many of the various topics that we worked on in the strategic planning process. Guiding principle 2 would be autistic people and their caregivers should be safe and healthy in their homes and communities. That's where we talk about safety, healthcare, caregiver supports, and so on. And again, I just want to be clear, this is still in the development phase, so we have a draft under review. Guiding principle 3, people with autism should lead lives with the greatest degree of self-determination possible, which is where we talk about issues that were discussed in many of the subcommittees, but we're taking them outside of those subcommittee subjects into their own topics. For example, adult guardianship discussions that were made in the safety subcommittee, community integration, which was a heavy topic in the housing subcommittee, and cultural competence and inclusion, which was discussed a lot in healthcare and education subcommittees as to how to ensure that type of integration in the community. That's sort of the structure where we're at, and what the draft looks like in an outline format. I just want, and I'm moving fairly fast, which is both terrifying and good, since then we can leave so much time for discussion. But I just want to point out, unless, Anne, do you want to contribute anything to that portion or no?
I do actually, if you don't mind, because at
Yeah.
this point, since I've been looking at the document, I probably know it better than even you do. I do want to just underscore that. So what Victoria just showed you was essentially the table of contents and the phase, what we're calling phase one, which is, as Victoria said, the higher level strategic plan. And these are the topics, like the buckets, for lack of a more elegant word, that where within each topic, so like looking at this slide, adult guardianship, community integration, cultural competence, under each of these topics, there's going to be discussed in the full document, which you will get to see soon. There's, you know, some background information about the issues and discussion and context, some research, if there's research available to support some of the concerns or ideas. Then there's going to be a list of objectives and strategies to support, you know, service or resource coordination for each of these topics. That's what will be in the phase one plan. So we didn't have the objectives and strategies ready to show you, and we're concerned that showing you these objectives and strategies out of context might be confusing. So we're just going to have you review everything all at once. Phase one plan is these objectives and strategies. Then, as Victoria said, there's a second part, which is the year-by-year work plan, which will drill down this, you know, objectives are pretty, you know, the guiding principles are obviously hugely broad. The objectives are a little narrower, coming up with a couple of like long-term goals that you'd want to support each topic. Strategies get a little bit more specific, but still fairly broad. And then the work plans will be that second document that Victoria mentioned, will be like, these are the action steps and the deliverables and the measurements for each of these strategies, if that makes sense. We just wanted to show you the general skeleton of the table of contents, but like I said, this is the highest level of high level we could give you. And then I said the phase one document will be ready for review soon.
Yeah, and like she said, that draft document is currently at the leadership review phase, and has been working with Secretary Beatty about that. But so I wouldn't be surprised if you know it by heart even better than I do at this point. It's been one of those where I also worked with all the policy directors at the agency, trying to integrate as many ideas as possible. So it was one of those beautiful messes of track changes. Unless people have comments,
Hello?
and there will be space. Sorry? Okay. I'm just gonna make
Yes, I'm in a meeting.
one.
Remind me, what do you do?
Nicole? Okay. I just want to point out that we have ASGARN vacancies. Ex officio, the Maryland Occupational Therapy Association has not sent a representative. So if you know people there, please talk to them. And as far as governor's appointments, we do have spaces by statute set aside for a physical therapist and a pediatrician. If you know either of people with these qualifications that would be great for this, please send them my way and try to persuade them to apply through the governor's office of appointments. And obviously, if they apply, tell me so I can highlight it to the folks in Annapolis. In that sense, and in one of these senses, I really appeal to the parents, because I'm sure you know pediatricians better than I do. I had one, but that was like 30 years ago. So, you know. With that, and you all and the members all got copies of the slide deck, so you have a link to that. Ellis can also send you a copy of the link for the Office of Appointments application. I also want to point out our upcoming meetings are December 10 It's per quarter, so December 10, February 11, 2025. That's the typo, but it's okay. June 10, 2025, and they're all on a Tuesday at 4:30 to 6 p.m. This is slightly tentative. Last year we had a time when we had to change the December meeting because I had jury duty that day. You know, Baltimore City jury duty, it happens once a year. So we will work with that and we will let you know as soon as possible if there's any changes. So with that, I do want to hear the ASGARN comments. We still have literally like an hour budgeted, but we did go over a lot of information on the draft and what to expect from the strategic plan. So I do want to make sure there is a lot of discussion. So yeah. And I'm gonna stop sharing for a minute. So if any of the members of ASGARN, yeah,
Hello?
Lydia.
Okay. I had raised this in a question maybe a couple of months ago, but I'm not sure if in the current version of the draft strategic plan, we were able to address the importance of ensuring financial education for both autistic people and their families during the transition process, transition planning to adulthood, whether that's for young people, ensuring access to financial literacy, financial education, and for family members, financial planning for long term, particularly thinking about savings vehicles, maintaining eligibility for necessary benefits, if that is important for a particular person in their family, and ensuring continuity of access to care and support, and long-term financial planning after a primary caregiver is no longer available. So those are aspects of transition planning that I think are relevant for education and overall quality of life, but I don't know if that got reflected.
So I would have to review the draft again to make sure, but one of the big priorities is specifically on ensuring independence as the main default outcome. And obviously, like, we're not trying to say abolish guardianship, for example, or more intrusive methods, but the idea is precisely to have greater public awareness, in my opinion, and encouragement of the resources available, and that will probably require, and I see that Delegate Guidance has her hand up, that will probably require more education, evaluating, and so on. Delegate Guidance.
Thank you so much. I really appreciate. I just want to give you all a huge hand and a word of appreciation for working so very, very hard over the last 6 months to get this really going in the right direction. And I do believe that we're there. And I also appreciate the Deputy Secretary sharing some of those plans with me. And I'm really comfortable that this group and this office is going in the direction that we intended when we passed this legislation through the General Assembly. And while we don't have all those very, very specific things laid out yet, I couldn't tell you how thrilled I am just to be a part of the process at this point. So thank you. That's all.
Delegate, it means a lot coming from you. I just want to say that. I appreciate your kind words.
Victoria, sorry, I don't know how to raise my hand on Zoom, so apologies for jumping in. And I echo your appreciation for Delegate Guyton's comments. It's really, thank you for your support. I was hesitating. I have a response to Lydia's question. I do not want to get to a point where everyone's trying to guess what's in the plan. Like, I want to, I can say that we did acknowledge the importance of financial planning is wrapped up into, I can't remember exactly where it falls, but that is one of either objective or strategy. I can't remember quite how it's framed. I will say, as part of the process, the information that was in the subcommittee reports, as Victoria said, not literally every idea can be reflected in a strategic plan. You have to do a little bit of like synthesizing and And not everything makes it in a particular draft, and you can always hold things for future work plans or strategic plans. We did try to reflect as much as we could in the subcommittee report. So hopefully people will recognize when you get a chance to look at this draft. And I apologize again that really I'm the only one who's seen the complete version right now. Hopefully ideally you will see your ideas reflected there, if not in huge specifics, because again, that's something that will happen in the work plans. But so we did obviously use the subcommittee reports to feed into the strategic plan. And as Victoria said, you will have a chance to review, again, with the caveat that we can't take all edits. But if you see something when you get a chance to review it that's glaringly missing, like obviously that's the kind of feedback we'll need when ASGARN is reviewing this draft strategic plan.
Yeah, I just want one comment I've made often is that nobody will be 100% satisfied with it, because every single one of us is very passionate about autism and the needs of the communities involved and so on. So everyone has something that for various reasons, often by personal experience, is passionate that should be there. And if I were to include every single input in detail, it would be like 700 pages long, and nobody wants to read that. And I don't think Anne would let me publish a 700-page long document either. But I would say, in that sense, I'm hoping that we will see almost everything synthesized in a more vague way that can then, and often another topic is when we go into the implementation phase that's over every year for the next 5 years. So hopefully sometime at the end of the decade, we'll be doing another strategic plan where we are evaluating the successes and failures and lessons learned. The idea is precisely that at that point in the work plan, ASGARN will keep happening and will keep being a space for input where we can discuss how the implementations are going, what should be implemented and how. And for example, if we're talking about financial independence, how do we implement that within the framework of what the state can and cannot do, for example, whether that involves specific trainings or policy actions that agencies can do and so on. Keeping in mind to an extent that the power of this document is entirely persuasive outside of the agency. Like, for example, I cannot go over to the state superintendent and tell him, this is what you're going to do on education, wag my finger and so on, or adding other agency. But it is persuasive, and we want to work with all the agencies and entities of the state government together to come to solutions that help make this plan a reality. Other comments and thoughts? Jolene, okay, yeah.
I have one, and it's kind of a stretch, but with Representative Guyton here, I've got a question, because if this doesn't occur for another 5 years, I'd hate to see Maryland way behind the curve on some things, because there is one particular issue that we've not necessarily put into this, but I don't know if there is a way that within the state we could encourage something, and that is to not have marriage penalties for those with disabilities that marry.
Yeah.
And I think it is something that we should at least go on the record of recognizing, rather than waiting for 5 years to do something. And I'm not quite certain if the legislature can even make some statements that could be encouraging, even on a national level, that this would be an aspirational type of situation.
Yeah, since I am here, I'll respond if that's all right with you, Victoria.
Go for it.
Yeah,
And after you,
certainly.
Lydia has their hand raised.
Okay, and then so I did put in the chat that, this is a living document. It will change over time, but not everything that everybody wants is going to be in this document. that
Uh-huh.
doesn't mean that it exists in a vacuum and that we can't do things outside of the vacuum. I know that Delegate Bloxberg's car is on this call as well. And, you know, between the two of us and the HCO committee and the Early Childhood Disability Committee, there is a lot that we will still be doing that are not things that are not going to be written out in this plan. So I would say, Jalen, to your point, if you have very specific items like that, then bring them directly to us. Don't count on anything that is really urgent to you. If it doesn't show up in the plan, then bring it to us. That would be my recommendation. Okay, thank you so much for mentioning.
I appreciate that very much. And I know a lot of other people will appreciate that. Thank you.
Lydia, you have your hand raised.
Yeah, just to add some context for those who might be less familiar with the issue of marriage penalties and asset limits, this is an area that I've been working on for several years. And unfortunately, currently eligibility for Social Security administered benefits and Medicaid is determined by federal law, which imposes means testing that is incredibly strict. The numbers were last updated in 1989. And so to some extent, addressing that issue requires federal action, which many disability advocates have been pushing for a long time, including in the current session of Congress. However, at the state level, it really can look like expanding access to education about and perhaps budgeting for and advocating for budgeting for making matching contributions into ABLE programs and people who have an account through the ABLE program right now, as well as seeking to ensure that people can receive financial planning support to maintain benefits eligibility within the state while we are seeking to ideally remove asset limits federally from those programs, just because of how much they not only penalize disabled people for seeking to be married, but also just trap disabled people in a cycle of lifelong poverty, even when a person is able to work or is supported by family in a situation where perhaps that person is not able to work and earn sufficient money on their own, but they have family support that would be willing to provide it to them directly. And it would be certainly much easier than to have to put somebody's money in trust if that's an unnecessary barrier to ensuring that person is able to exercise any amount of control or autonomy over any level of their finances. But like, I would be happy separately from this meeting to talk to you, Jalen, or anybody else about the intricacies of what's happening federally around asset limits.
That's very nice to hear. Good, thank you.
Obviously, I cannot endorse any legislation without that, and obviously I will make the offhand comment that it is indeed mostly a federal topic that the state can aspirationally touch on a little bit. So I will leave that to the delegates in the room to figure out what are best ways to reach out on that. And obviously the agency remains at your disposal if you have questions or wish to talk to us at any moment. And LS manages my calendar and also Anne's calendar, so we can always figure out a time for discussion. I want to hear other questions and thoughts before I move on to the public comment section. So if other ASGARN members have thoughts, also, once we get to the public comment section, ASGARN members can keep talking. It's just that at that point, general audience members can also do so.
If no one else is asking a question, may I ask one more?
Go for it.
With all of the recommendations and observations that we have put into this strategic plan, there is something that I have not been able to find, and maybe it does exist and I haven't been able to find it. A comprehensive list throughout the state of Maryland about care providers, schools, different types of training, help for the autistic population, kind of county by county. I end up getting calls from parents that are in different counties, and I have no way of necessarily easily getting into things or even comparing between counties, as people sometimes are asking for recommendations of where there would be greater support in one county over another. Is there a way that we could get a list even of college and university programs, maybe stronger high school programs, so there is a database? Because some of the information that we have, people may want to act on it, but they may not know necessarily where to go.
So off the top of my head, I can say that one of the biggest topics that was discussed in just about every single subcommittee during the process of earlier in this year was consistently that of data and information databases. Like, for example, in employment, there was a whole long discussion of having a resource database about all these resources from the state. Similarly, in other spaces around housing, what are the resources that housing has? And well, it feels a bit specific for the broader strategy plan. It can definitely be part of the input that we consider for the implementation, whether this year's or next year's, and so on, since there will be a work plan or implementation plan for every year, hopefully. Rebecca and I believe PFA has attempts at databases. I don't know what you can give the details, you know them better.
Sure. So yeah, we have a database of providers throughout the state that address many of the issues Jaylene brought up. And we're always looking to expand that and adding new providers. So my first answer would be, please consider referring them directly to Pathfinders. Nikki Stokes on our staff, talks to people every day and helps them navigate all these questions. If we don't know the answer, we'll do our best to connect with the agencies that we work with to see if they can help direct us. So I hope that the first thing you would do is direct them our way. Our database is pretty comprehensive. There's over 3,000 providers in there that cover all aspects of life throughout the lifespan. So it serves adults as well as children. So
Excellent. Thank you.
Mhm.
I'm gonna start moving it to the public comment section so that people who are part of the general public can speak up if they need to. But in the same process, ASGARN members can keep talking and having ideas. And well, one thing, if you have, I like to say that if you have a comment or question that you're afraid of saying in front of the whole crowd, or for that matter, you're thinking you come up with the idea that you need to ask or this or whatnot after the meeting is over, you can always reach out to us. I have very much an open door policy. My phone is right here. I prefer text and email other than phone calls, but because unsolicited phone calls feel like a hostage situation for my generation, but with that, do other people have comments or concerns? And I don't mind finishing 45 minutes early, but I do want to make sure everyone gets their say. Awkward silence. Okay. Okay, I just want to say again, I know we've gone through a lot of information with the fact that we have finally a draft of the strategic plan. Like I said, my first draft was 50 pages, and then when Ann took the red pen to it, it became 30, and then all the policy directors took their hand at it with track changes, and then now Ann and the secretary are going at it. So that's where we are at, and you saw like a table of contents level outline of what it will likely look like. Like I said, we're hoping to, once we have a final draft, show an embargoed copy to the members of ASGARN. and by embargoed, I mean not to be released publicly, not to be made public. And with that idea, there will be the opportunity for feedback without any guarantees even I can make that it will make it because of higher level processes that need to be done as far as review. But with that in mind, those were my closing remarks. To be honest, I just want to thank everyone who has helped this process become so much smoother over time. Unless you have other ideas, I just want to thank you all for the process of the strategic planning earlier this year, where we spent the entire spring and part of the summer into it, which is now forming the backbone of the drafts that we're working on. And with that, anything you need, please reach out. Here's my contact information. You can take a screenshot or download it or copy it down, or if you decide, or you can look up my contact info, that of me and my assistant Ellis online, and then reach me out that way. So yeah, with that, I will entertain any motions to adjourn if anyone wants to do that.
I'll second that.
I'll make the motion. This is Lydia. I move to adjourn.
I second that.
Okay, moved and seconded. Is anyone opposed? Okay, seeing nobody opposed, the motion can pass by acclamation. So with that, we will give you back 38 minutes, 32 minutes of your time or something like that, or 42 minutes. And thank you so much. And again, just because it was short, don't feel free to reach out to me. Thank you.
Right.
Thank you.
Thank
You're
you.
welcome. Bye.
Aye.